Good morning, family and friends. Today we'll look at the risk factors and signs of colon cancer. At the onset, there may be little or no symptoms. Possible symptoms, especially in the early stages, include a persistent change in colorectal habits. Now, the key word here is persistent change, such as constipation, diarrhea, changes in stool color, changes in stool shape, such as a narrowed or pencil-like stool, blood in the stool, bleeding from the rectum, excessive gas, abdominal cramping, abdominal pain, and unexplained weight loss. If you notice a change in your bowel habits that is persistent, make an appointment with your doctor to discuss getting a colorectal cancer screening exam. Now let's look at risk factors. There are fixed risk factors that cannot be changed, and there are modifiable risk factors that can be changed. The first fixed risk factor is age. Your chances of developing colon cancer increases as you get older. Other fixed risk factors include a prior history of colon polyps, a history of bowel disease such as Crohn's disease or ulcerative colitis, a history of certain hereditary colorectal syndromes, being of Eastern European Jewish or African American descent, a family history of colorectal cancer or hereditary colorectal syndromes, and lastly, a history of radiation to the abdomen or pelvic area to treat a previous cancer. Next, let's look at modifiable risk factors. And this simply means they are avoidable and you can change them to decrease your risk of developing colorectal cancer. They include being overweight or obese, having type 2 diabetes, being sedentary, smoking, and indulging in alcohol. Alcohol is a known carcinogen, and the amount of alcohol required to cause cancer varies from person to person. So therefore, there is no safe level. So now that you know all the modifiable risk factors, why not start today to make some changes to reduce your risk? That's it for today. Join me next Tuesday when we will discuss the different screening modalities for colorectal cancer.